Hi everyone, this is Meldita and I'm back. This is coronary blood flow, depolarization and axis formation. Okay, we should have a good blood flow to be able to have a good electrical stimuli formation, conduction before depolarization. So here, our blood supply comes from our coronary arteries. We have the three major arteries in here, the right coronary artery, that one, and the left main that divides into left anterior descending artery and the circumflex. There's a branch from the right coronary artery called sinus node artery, and that supplies blood to the sinus node. When the sinus node gets its blood supply, it will be able to do its job. This is the normal pacemaker to produce electrical stimuli. So that is generation of electrical stimuli called the automaticity. Okay? And from there, the stimuli spreads out to the atria, depolarize and contract them, but I'm not going to talk about contraction here. And other stimuli will pass through the AV node to the bundle of His, right and left bundle branches to the Purkinje system. So the stimuli that get into the AV node until the Purkinje system will finally reach the right and left ventricles here. So before depolarization happens, the right and left ventricle, they have negative, which is potassium inside, and sodium outside is positive. We just focus on two elements in here, the potassium and the sodium. There are some elements involved in here, but they are the major players here. Okay? So when the right and left ventricles are polarized, they are actually negative inside and positive outside. So now, the electrical stimuli that come from the sinus node, from the Purkinje to the ventricles, okay, then depolarization will start as soon as the stimuli will reach the ventricles. Primarily, the first part to be reached is the left side of the septum. So this color yellow before they get depolarized is actually negative. But when the part of this septum, the left side of the septum, which is actually the first part to be depolarized, turned red. So it turned red because the sodium gets in and the potassium came out. So that is the initial part of the ventricles that will be depolarized. The left side of the septum. Next, the depolarization will spread, and this time it occupies almost 2/3 of the septum, and to the right ventricle, to the left ventricle, and to the inferior part of the ventricles. So this red is actually the sodium in, and the potassium now is out. Next, the depolarization continued to spread, and it had already occupied the whole left and right ventricles. It all turned red. So this time, the sodium positive is in, the potassium negative is out. Okay? There are two planes of the heart. We got here the frontal, and we have here the horizontal. So the frontal plane, this is it. So it's like cutting the heart front and back. And this is what it looks. We got the right ventricle here and the left ventricle and the septum in the middle. And in the frontal plane, there are 6 lymph leads in here. We have the lead 1, 2, 3, AVR, AVL, and F. This picture here, half of it upward are all negative. Downward is all pluses. Upward is all minuses. And their difference is 30 degrees. So 0 as the baseline, the minus 30, 60, and so on and so forth. If you look at the ECG, these are all negative deflection. Down below, we got positive 30, positive 60. So there are 30 degrees, differences, but they are all pluses. So when you see an ECG pointing to the positive side, they are all positive deflection. The important surfaces that are being useful in this plane is the the lateral, high lateral, and the inferior surfaces of the heart. So what you see on the lateral leads is AVL and 1, or 1 in AVL, I should say, and the inferior is 2, 3F. So the significance of this side of the heart, this is the flow of all the electrical activity. This is now what you call the axis. So this is the axis. That is actually the normal direction of all these electrical activities of the ventricles toward the left side, and that's it. So the axis, that is the major direction of all electrical activities. And the normal range is from -30 to +90. So that is our normal axis. So if you look at here, this ECG is in here. If you look at lead 1, you still have an upright QRS. It's still within the range. Lead 2, the lead 3, you have that too, but it becomes smaller. As it goes away from this axis, the lead 3 is getting smaller. But if you see lead 1 and lead 2, you see that the QRSs are actually big because they are within the range of the axis. And the AVR is not included because it's looking inside the chamber of the heart. And we have also the AVL, which is farther away, and we said the QRSs are getting smaller. The other plane of the heart that is useful is the horizontal plane, and that utilizes our chest or precordial leads from V1, V2, V3, 4, 5, and 6. So our ECG shows our horizontal, or shows our lymph leads, which is the horizontal plane, and it will also shows horizontal plane, which are the chest leads or precordial leads. So we have here, as I said, if we cut the heart from top to bottom here, let's say cut that into half, and then I look down to the heart, this is what I see. The leads that I see, the leads that I see here are actually surrounding the heart. Okay, so we have here V1, V2, V3, 4, 5, and 6. So if you look at it here, if you say anterior septal surface of the heart, the leads that are being used are V1 and V2. If you want to see, that is the anterior septal. So that is the anterior septal. Actually, also V1 is facing the RV. This is the anterior septal. If you want to see the apical part of the heart, this one here, or the anterior, then you have to use V3 and V4. And if you want to use the lateral again, there is also V5 and V6. So you are wondering how come there is a lateral in the horizontal or in the chest leads, and there's also a lateral here on the lymph leads. Yes, but that lateral leads in the lymph leads is actually high lateral. And the lateral leads in the chest leads are actually the low lateral. But if the patient comes in with non-STEMI and STEMI, we all use these leads. 1, the AVL, 5, and 6. Okay? So that's about it. So if you think this presentation is beneficial to you or you like it,